Okay, welcome back, everyone. We're going to finish up this set of lectures with talking about newborn anomalies and how to code them, starting with that newborn code that we just talked about, Z38, and when to use it as opposed to Z37. Again, the very first code on a baby's chart will always be a Z38 code. This is a live-born infant, right? And you can be a newborn once. So if a child is born in an acute care hospital and then sent to a children's hospital or sent to an emergency room a day after they get home or what have you, and they have to come back, you don't apply the Z38 code. The Z38 code is only used when the baby is actually born in a hospital. Let's have a look at some of those. And again, right out of chapter 16 as in the ICD-10-CM codebook, Z38, a code from Z38 is assigned only once to a newborn at the time of birth. If the newborn is transferred to another institution, a code from Z38 should not be used. It's only used on the newborn record, not on the maternal record. It's a one-time use code. And again, we'll talk more about this, but live-born infants, you can use this as a principal diagnosis for babies born in the hospital. And here they are, Z38. It's the principal code on the initial birth record only. It's not used anywhere else. So a single live-born infant delivered vaginally, Z3800. Z3801, single live-born by C-section. Okay, so you can see these right here. And then single live-born born outside of the hospital, Z38.1. Z38.2 is when it's unspecified. So you can see those right here. And again, very first listed code as we saw. Now we have observation codes. So if a baby's being evaluated for something, it will be a code used from the category Z05, Encounter for Observation and Evaluation of Newborns. And again, it's only used for newborn. When does the newborn period start? It goes from birth up to and including the first 28 days of life. Any clinically significant conditions also need to be coded. That would be diagnostic procedures, vents, all these other different types of things. Monitoring, any different types of things like this. Then when we get into the P codes, P as in pediatrics. So remember how we had pregnancy complicated by? Now we have newborns affected by. And in a lot of ways, they're very similar. You can have a pregnancy complicated by maternal hypertension, and you can have a newborn complicated by these types of things. Some examples of some of the common ones that we see: respiratory distress syndrome, congenital anomalies, congenital cardiac issues such as PDA, necrotizing enterocolitis, NECs. All these things are conditions that are affecting the newborn. Well, baby checks, again, these are exams, and they run the gamut from under 8 days, Z00.110, 8 to 28 days, Z00.111, and Z00.121. All these are well baby checks. May also have some genetic abnormalities. You can see some of them here, the hypercholesterolemia, cystic fibrosis, and others. We can have congenital anomalies. These are abnormalities that are present when at birth. And this can be inherited. We can also have malformations. These are things that happen during gestation. So this chapter may come across as very challenging, very confusing. Think of things in two ways. The urogenitory types of coding, look up the disease as the main term. When you think about the complications, think pregnancy, complicated by, delivery, complicated by, and then newborn, affected by. Keep all those things separate, and then also take a look at the Z37 versus Z38. There's the outcome of delivery, and then there's the newborn code. I hope you found this useful. We'll see you online. Bye now.